Welcome to the fourth webinar in the Grand Challenges for Social Work series, focused on the Grand Challenge to create social responses to a changing environment. I am Sarah Butts, Executive Director of the Grand Challenges for Social Work Initiative, sponsored by the American Academy of Social Work and Social Welfare. Today's presentation will be led by Dr. Lawrence Palinkas, who serves as co-lead for the challenge, along with Susan Kemp, University of Washington, and Lisa Reyes-Mason, University of Tennessee, Knoxville. Dr. Palinkas is the Albert G. and Frances Lomas Feldman Professor of Social Policy and Health and Chair of the Department of Children, Youth, and Families at the University of Southern California, Suzanne Dork Peck School of Social Work. He also holds secondary appointments as professor in the Departments of Anthropology and Preventive Medicine at USC. So now I welcome Dr. Lawrence Palinkas.
Thank you very much, Sarah. It's a pleasure to be with all of you today. I find it somewhat ironic, however, that I'm giving a presentation about creating social responses to a changing environment on a day when the President of the United States is going to announce that he is withdrawing from the Paris Accords on global climate change. It perhaps reflects a challenge that is ever evolving in our attempt to solve the problem and to seek solutions that are not only viable and effective, but also enjoy the consensus and support of the general public. Today I'm going to talk to you about the grand challenge of creating social responses to a changing environment. I serve as one of the national co-chairs of this grand challenge. Susan Kemp, who's based at the University of Washington in Seattle, and Lisa Reyes-Mason, who's at the University of Tennessee, Knoxville, serve as co-chairs as well to this grand challenge. The aim of this grand challenge is really threefold. The first being to accelerate and elevate social work's role in addressing the social and human dimensions of rapidly changing global environments, developing, adapting, and testing, as well as implementing innovative, equitable social responses and interventions. And then finally, strengthening or aligning and focusing the profession's socio-environmental research and practice capability, one that has traditionally been a part of the profession, but is now being placed in a very different context than perhaps may have occurred 100 years ago. But this alignment, including educational and curricular transformations. So the environmental challenges that we are addressing in this grand challenge really focus on three particular but interrelated issues. The first having to do with global climate change, the second having to do with increasing urbanization worldwide, and then the third, which is more of a traditional social work focus, having to do with environmental injustice and environmental degradation. Global climate change, as I mentioned at the beginning of this presentation, has been getting a great deal of attention, both in terms of the extent to which the science has documented the occurrence of such change, as well as the controversy that this documentation has created. The third intergovernmental conference on global climate change, for example, found that by the year 2100, they expect to see average increases in global temperatures ranging from 1.5 to 5.8 degrees Celsius. It's certainly been evident, particularly if you live in coastal areas, and particularly coastal areas along the east coast of the United States, that rising sea levels are beginning to inundate low-lying areas. In the Western Pacific, we see this especially in developing nations such as Tuvalu, the Marshall Islands, the Maldives, and the Solomon Islands, as well as Fiji. But we're also seeing more intense and more frequent extreme precipitation events, hurricanes, cyclones, typhoons over most of the mid-latitude land masses around the world. In contrast, we see in other parts of the world, particularly sub-Saharan Africa, more recently in the western United States, of a decrease in mean precipitation, leading to prolonged drought, increased risk of wildfires, and rising water insecurity. Ocean levels at the same time that they're rising are becoming more acidic. So we see a decline in pH levels, which has negative impact on marine life as a food source. The most visible manifestation of climate change that has had a significant social impact in recent years has been the increase in both the frequency and severity of natural disasters. So, as this chart indicates, we see a dramatic rise in the occurrence of such natural disasters, particularly hurricanes and typhoons, which are definitely climate related, as well as other natural disasters like typhoons, like tornadoes, for which the evidence is less clear on its relationship to climate change. But certainly you can see by beginning in the 1980s, a dramatic rise in the number per year. We also see that the number of people impacted by these events began to increase, also beginning in the mid 60s and early 1970s, becoming especially pronounced after the year 2000. Now, these changes, whether they are acute events such as a hurricane or flood, or long-term chronic events such as prolonged drought, are likely to have significant impacts on economic activity, such that we see evidence of diminished terrestrial and inland water ecosystems and the associated biodiversity in these regions that will likely adversely affect the ability to grow crops, for instance, or engage in other forms of economic activity. In coastal regions, we're likely to see significant declines in the harvesting, both commercially and for subsistence purposes, of marine life. We're also likely to see adverse economic impacts resulting from acute events like disasters, so that worldwide economic losses from such events rose from 50 billion a year in the 1980s to under 200 billion a year in just the last decade. In the last, during the same period, we found that it's been estimated that $3.8 trillion were lost as a result of these events, much of it having to do with extreme weather. Another area where climate change is likely to have a significant impact is with respect to human health, so that you can see whether it relates to the depletion of ozone in the stratosphere or increased desertification and land degradation, loss of biodiversity, or the loss of fresh water. All of these are likely to have, in one form or another, an impact on human health. As this chart indicates, whether and the extent to which these health impacts may occur are related to a number of mediating factors, including the loss of habitable environments, increased poverty, mass migration, violent conflicts, and civil disorder, as well as other social determinants of health. But we're likely to see impacts that include undernutrition, adverse mental health conditions, cardiovascular disease, respiratory diseases, vector-borne diseases such as the Zika virus, as well as harmful algae blooms. You can see from this chart that we're likely to see even gradual, longer-term impacts in addition to specific illnesses. So changes in fitness and activity levels, for example, or heat-related illnesses, particularly during the summer months, increased allergies, cases of asthma, particularly in children, as well as increased exposure to waterborne and vector-borne illnesses. With respect to mental illness, we'll see likely occurrences relating to exposure to life-threatening events like hurricanes, leading to post-traumatic stress disorder or substance abuse. But we'll also see longer-term mental health changes relating to a sense of loss, degradation of environments, as well as the strain on social relationships. Now, certainly at the community level, climate change has already been shown to contribute to increased levels of interpersonal aggression, violence, and crime, especially during periods of intense heat, decreased social stability, as well as community cohesion. Certainly, in terms of specific mental health effects, we can see that climate change related conditions that are acute or subacute as well as chronic will have a number of potential pathways that lead to both acute as well as long-term instances of mental health and behavioral health problems. One area where climate change has had a particular impact in a population that is particularly vulnerable is with respect to children. So perhaps one of the more dramatic instances of a climate change related event in the United States, Hurricane Katrina, which occurred in 2005. Subsequent studies documented a significant increase in PTSD symptoms in school children, prevalence of severe emotional distress being significantly higher than the national population, and conditions that persisted as much as 2 years after the event itself. These events were particularly noticeable in school settings as well as primary care settings, so that there are very few sectors of child serving systems that are unaffected by events such as this. Climate change, in addition to the health impacts, has also led to increasing numbers of individuals who have been forced to relocate because the areas that they live in are no longer sustainable or habitable. It's estimated, for example, that according to the Environmental Justice Foundation report in 2009, that as many as 500 to 600 million people, or 10% of the world's population, are at risk for displacement due to climate change. This is especially true in low and middle income countries like Bangladesh, Kenya, Papua New Guinea, Somalia, Ethiopia, Rwanda, where we're likely to see large movements of people due to climate change. We're already beginning to see such movement from sub-Saharan African countries like the Central African Republic and Chad, where large numbers of individuals are fleeing areas experiencing prolonged drought and merging with other immigrant refugee populations on their way to Europe, seeking a new life and relief from the strain that they've been experiencing due to climate change. But even in the United States, we're likely to see increasing numbers of internal ecological refugees as more people move, for example, from arid or fire-prone areas to the areas with more equitable climates. It's estimated that over 375 million people a year are likely to be affected by climate-related disasters, even if the displacement is not a permanent one. But oftentimes, it can range from temporary to permanent relocation, 50% more having been affected in an average year than was the case in the past decade. As to the how significant the extent of what is now being referred to as climate refugees are. It's estimated that such refugees outnumber those fleeing persecution and violence, such as what is occurring in the Middle East, like Syria, Afghanistan, or Yemen, that for every person fleeing a civil conflict, 3 individuals are fleeing a uninhabitable climate. Even in the United States, we're beginning to see instances of where mass relocation is occurring due to climate change. So in small communities living in coastal areas such as Shishmaref in Alaska or Ile de Saint Jean in Louisiana, entire communities have been forced to relocate because their coastal communities are no longer inhabitable. Perhaps the greatest instance of relocation occurred after Hurricane Katrina in New Orleans, which is still at a level of population significantly below that prior to Katrina, because a number of people were relocated to other communities in the United States and never moved back in the aftermath of Katrina. It's estimated that such relocation in the United States is likely to occur. So as you can see from this map, it could very well be that by the year 2100, we're no longer going to be seeing a state of Florida because it'll be completely submerged. Areas of the eastern coast as well as the Gulf Coast are also likely to be submerged, which will necessitate relocation to other parts of the United States. Now, in addition to climate change, there are other changes in our environment that our grand challenge is focused on. Perhaps one of the most prominent has to do with increasing urbanization. We see instances of both the manifestation of growing numbers of residents in urban settings in the United States, as well as the social problems resulting from this increasing in population in these areas in a number of different ways. Similarly, the traditional focus of social work on environmental injustice has also gained new prominence, especially as infrastructure here in the United States and elsewhere is showing notable instances of deterioration and decline. Now, it's well known that while the majority of the population in the United States is already urban dwelling, by 2050, it's estimated that 90% of us will be living in cities. And in fact, nowadays, the 1/3 of the world's urban population lives in very informal settlements in environmentally marginal locations, usually in areas that have already experienced degradation or are prone to flooding, prone to pollution, and have very few resources in which to address many of these instances of degradation. Certainly, with increased urbanization, there's a significant impact on the natural environment, but it can also have impacts on other ways, particularly to the populations living in these areas. One only has to look at the deterioration of water systems in Flint, Michigan, and the increased risk of exposure to toxic lead from the pipes as evidence of this. But certainly exposure to other household hazards like mold, mildew, and pests are likely to incur with increased urbanization and the consequential risk to the physical environment. Now, just as climate change has been documented to have significant impacts on mental health, Environmental degradation has also been shown, leading to increased domestic violence, depressive symptoms, suicide, anxiety. There are a number of different pathways by which a decline in the quality of the urban environment or the environment in general related to increased economic activity of certain forms, as well as to the decreased availability of quality infrastructure and resources, can produce significant mental health effects, all of which are likely to show up in routine interactions with clients by social workers, which may not necessarily have an explicit focus on the environment itself, suggesting that while oftentimes environmental changes may not be front and center with respect to the issues that social work address, that they certainly are implicated in many of the issues that social workers must confront in their day-to-day interactions with the communities that they serve. And certainly, uh, as we noted at the beginning of the presentation, these issues do not exist in isolation, but are intimately connected to one another. So that with increased urbanization comes increased impacts on climate change, and with increased changes in the physical environment, the quality of life in urban settings becomes more and more compromised. Above all, we have to keep in mind that the reason why this is a social work grand challenge and not just a grand challenge that might be a focus of other professions such as engineering or medicine or public health, is that it's a social justice issue. So that when we begin to think of the populations that are most vulnerable to the climate change impacts, we're talking about the communities that have traditionally been the focus of social work practice and interventions, whether it relates to women, children, older adults, the poor, or communities of color, or those with a history of mental health problems. These tend to be the populations that are most vulnerable to climate change impacts. And certainly when we think about our NASW Code of Ethics, we note that paying attention to the environmental conditions, forces that create, contribute to, and address problems of living stands first and foremost as one of our responsibilities as social workers. In the past, we've tended to focus on the social environment as the object of our attention. But even in the days of Jane Addams, who acknowledged that human nature is relentlessly pressed upon by its physical environment, the need to correct or alter the physical environment as a key to improving the social environment and improving the quality of life of the populations that we serve has been an important part of the mission of the discipline of social work. Similarly, understanding that if we're going to reduce social vulnerability, we have to increase ecological resilience. That the two are fundamentally linked together really serves as the foundation for this particular grand challenge. Now, the priority areas that have been established for this grand challenge are fourfold. The first being disaster preparedness and response. Second, having to do with environmentally induced migration and population displacement. The third, having to do with community level organizing and development that's really aimed at social sustainability, strengthening local capacity to respond to environmental changes, especially in urban settings. And then finally, targeting policy advocacy and practice engagement by understanding the fundamental causes of social vulnerability and environmental change, and seeking effective solutions to these causes as well. One example of how social workers have been engaged in these efforts is illustrated through the efforts of the Suzanne Dwork Peck School of Social Work faculty and students who participated in an effort to respond and deliver services in the Philippines in the aftermath of Typhoon Haiyan in 2013. A group of faculty and students left in November of that year to begin a 2-day training of Philippine government officials, NGO staff, and leadership in a variety of evidence-based approaches to disaster preparedness and response. Dr. Marlene Wong, Annalisa Enrile, and Vivian Villaverde led this team. And in the aftermath of this 2-day training, USC was subsequently asked to provide training to all school teachers in the Philippines through the Federal Department of Education, in conjunction with other federal departments that were involved in disaster management and mitigation. Subsequently, Doctors Wong and Villaverde returned to the Philippines to provide similar training to the Philippines Peace Corps as a way of preparing the first responders in the event of subsequent typhoons or other natural disasters to deliver services to those particularly in need who were impacted by these events. This effort relied on a model of disaster preparedness and response that actually emerged out of the experience of conducting research on technological events such as the Exxon Valdez oil spill or the Deepwater Horizon oil spill in the Gulf of Mexico, that looked at impacts of events like this and responses in terms of tiers. The first tier having to do with targeting eco-social impacts, such as the challenges of cleaning up after an event like this, the likely economic impacts and loss of income, as well as infrastructure, cultural impacts, such as the inability to engage in subsistence activities, certainly health impacts, such as morbidity and mortality related to injuries due to these events, as well as likely litigation resulting from the lack of quality infrastructure, the inability to prepare in advance for these impacts. Tier 2 services have to do more with the social impacts of these events. Whether they are technological in nature, like an oil spill, or a natural event like a hurricane, research has demonstrated significant reductions in levels of social support, increased levels of social conflict and tension, as well as increased uncertainty as to where to access resources, whether and how to rebuild after an event like this, and how future events can be mitigated. Tier 3 services, the ones that social workers have traditionally been involved with, usually involve the treatment and delivery of services to address increased rates of psychiatric disorders like PTSD, generalized anxiety disorder, and depression, increased rates of substance abuse, psychosomatic symptoms, levels of domestic violence, as well as changes in child developmental outcomes. Now, tier 1 interventions certainly can occur in development and improvements in the infrastructure of healthcare systems prior to a disaster. During the event itself, implementing policies that ensure equitable distribution of cleanup jobs. which has been a significant issue in past events, particularly in the United States, that has led to social and community conflicts. And then post-disaster economic development and employee retraining programs, providing alternatives to cultural activities such as subsistence and recreation, as well as implementing policies that might speed litigation or reduce the need for litigation. Tier 2 interventions might include, at the prior to a disaster, community leadership that is designed to foster social cohesion, risk communication interventions during a disaster, and then the use of evidence-based practices post-disaster that are designed to build and sustain social support networks. Tier 3 interventions, the ones that we are currently involved in training our MSW students, include identification of at-risk populations, targeting the use of evidence-based practices such as trauma-focused CBT or evidence-informed practices like psychological first aid, to address ongoing symptoms and disorders, and then post-disaster, the longer-term responses using evidence-based practice to build individual and community resilience. Some of the examples of evidence-based treatment programs that are currently in use include the cognitive behavioral intervention for trauma in schools, which is now, as I mentioned earlier, being used in the Philippines as a way of training school teachers to assist children in dealing with the aftermath of natural climate-related disasters, as well as psychological first aid, a tool that is increasingly being used by first responders to assist individuals who are impacted by these events in the aftermath of occurrences of disaster, as well as acts of terrorism, thereby helping to reduce the initial distress, as well as providing appropriate referral to longer-term services and fostering both short and long-term functioning. In terms of resilience programs, instances like Strengthening Families program or Coping with Work and Family Stress might be potentially applicable in the aftermath of natural disasters, as well as other life change events that may impact families and individuals. With respect to climate change resettlement, the Grand Challenge has been focused on promulgating and proposing, as well as promoting, expansion of research on both the drivers of climate-based migration and relocation, as well as the consequences and spatial distribution of these events. Certainly, we feel it's important to raise awareness of the numerous instances of events that are tied to global environmental migration, and how they may be related to other occurrences that are forcing populations to move from one country to another, such as the civil conflict in Syria, which also has been attributed to changes in the local ecosystems there. Advocating for new and enhanced policies that may protect environmental refugees, as they currently do not have refugee status under the Geneva Convention. Pushing for legislation both internationally as well as nationally and locally that would grant legal status to these individuals in advance of changes in legal status as refugees. Certainly, strengthening community resilience in terms of identification of the needs of this population, how they relate to the needs of other immigrant and refugee populations, and how they are distinct from those populations. developing strategies that may provide a form of migration with dignity so that relocation is both planned and long-term. But certainly working with these communities to identify their needs and to effect solutions to those needs is paramount as well. Um, uh, Throughout the migration process, human security remains an important consideration and one that social workers must also pay heed to. With respect to community level organizing and development, certainly it's important that social workers be involved in coordinating activities in the local level as they affect healthcare, educational, and agricultural systems, but focusing simultaneously on three distinct but overlapping components of sustainability. So while social work has traditionally been concerned with social sustainability, one cannot have that social sustainability unless economic and environmental sustainability are addressed simultaneously. Social workers have traditionally played a role in capacity building and empowerment. They're increasingly being called upon because of these changes in the physical environment to supporting building resilience and recovery of human capacity. Many innovative programs and practices are relying on social enterprise techniques in order to accomplish this. The Grand Challenge to date has produced a number of accomplishments, certainly in the area of dissemination. We've been actively engaged in publishing both the scope of the Grand Challenge as well as pointing to areas in particular need of attention. At last count, I believe we have 4 book chapters published or in press, 2 journal articles, and a couple of policy briefs. We've given a number of presentations at national or international venues. We've also hosted or been involved in participating in a number of conferences, including a conference held in St. Louis last November, hosted by Lisa Reyes Mason, one of our co-leads on people and climate change, vulnerability, adaptation, and social justice. And another conference that was held in Seattle that was co-facilitated by Susan Kemp, another co-lead on urban environmental justice in a time of climate change. As I noted earlier, USC faculty have been involved in training social workers and other first responders in evidence-based techniques for disaster preparedness and response in the Philippines. They've been doing similar trainings in South Korea and the United States. We've also been actively engaged in research efforts that focus on disaster preparedness and response, on climate-related migration, food and water insecurity, the impacts of climate change on older adults and youth, climate change-related events and urbanization in low and middle income countries, environmental injustice, the impacts of climate change on indigenous communities, and the relationship between urbanization and climate. Where we see the grand challenges moving in the future revolves around 4 particular areas. The first having to do with adapting and implementing existing social work interventions at a number of levels, whether they relate to psychosocial treatments such as trauma-focused CBT or cognitive behavioral intervention treatment in schools, or community mobilization or policy advocacies or resilience building interventions. This is an important area to which this grand challenge seeks to mobilize social work responses. developing sophisticated interdisciplinary research that not only demonstrate the impacts of climate change or urbanization, but identify points for intervention, developing and honing innovative, equity-oriented, and evidence-based strategies that help to solve many of the problems related to these impacts. Building impact-oriented partnerships, not only within social work, but with members of other disciplines like engineering, medicine, and public health, urban design, environmental health. But these partnerships should certainly be grounded in relationships with communities, but they should also span regions as well as national borders. And then finally, contributing to the educational transformation of social work as a profession at all levels, from bachelor's to the doctoral level, is an important focus of our particular grand challenge. We, in the end, feel that social work is poised to lead the way in achieving these social responses to changing environments. Not only because it reflects our commitment to social justice, but it capitalizes on our unique experiences in working with vulnerable populations and our ability to translate research into policy and practice. So I want to thank you for spending this time with me today. I'm willing to take questions if you have any. We have left our email addresses in case you wish to contact us to ask us more about the Grand Challenge or how you might become involved. Thank you once again.